Hello, you're all welcome once again to Health Talk with Nurse Irene. I'm continuing my discussion on pressure injuries. In my previous video, I did talk about tips to prevent these injuries. Today, we're going to talk about the management of these injuries. As discussed in the previous video, pressure injuries are classified into stages. We're going to discuss management of stage 1 and stage 2 today. Stage 1 pressure injury presents with redness to the area as well as warmth to that area and what we call non-blanchable erythema. That is when you press the area of injury, you notice that it still remains red. It doesn't go pale like it usually would. In lighter skin individual, you notice the redness, but sometimes in darker skin individual, you notice bluish or purplish color to that area. Treatment begins with relieving pressure of that area and preventing friction and shear. You can apply a transparent foam dressing to protect the area because you want to protect it from opening, because remember the skin is intact. So put the transparent foam dressing on there, ensure that it is breathable so you do not retain moisture to that area. Then you want to reassess in 3 to 5 days, but because it's transparent you can even see the injury right through the dressing. You can also apply a silicone foam dressing to that area, ensure that it is breathable, and keep it intact for about 3 to 5 days and reassess. When you take the dressing off and you notice that the redness still remains, you want to ensure that you are really relieving the pressure of that area. Now to the management of stage 2 pressure injuries. This usually presents with either an intact or a ruptured blister or just a partial loss of skin. It could have been a stage 1 that has progressed to stage 2, or the wound just started as a stage 2 injury. Treatment for these injuries begins just as the stage 1, relieving the pressure as well as reducing the friction to those areas. The preferred dressing for stage 2 pressure injuries are the hydrocolloid dressings as well as the light foam dressings. Usually we have some kind of drainage to these areas because they are open. You might get some kind of exudate coming from these wounds. So depending on how much exudate you're getting, then you choose your dressings. Hydrocolloid dressing promotes a moist wound environment, which we prefer. We don't want to over dry this wound, so do not choose a foam that is thicker if you do not have a lot of exudate. Okay, you over dry the wound and you do not heal the wound when they are dry. You want the wound bed to be moist. So hydrocolloid, as I said, are the best in maintaining these kind of wound environments that we prefer. Lighter foam dressing also will give you that kind of wound environment. So depending on how much drainage you're getting, as I said, choose your dressing according to that. You do not also want to change the dressing frequently if you don't have to. Frequent dressing changes usually halts the wound healing process. So you want to leave it on for about 5 days. If you don't have any concerns with infection or if you don't have so much drainage on, I'd advise you to leave the dressing on to promote good wound healing. A little summary of what I said in Chi ni say adano video na ye ka ho asem na ye ka pressure injury ekura ye nya esan say ye da fa kono intino so wunya sa kro na kwan obefa so obebo ho ban ye won stages and ye can stage 1 and stage 2. Stage 1 no eya na ekro no mbie ye ubon se ho no aye kokko intino wunya transparent film dressing na wodi atoho na umma nsuo enkosa area no na sa pressure no so bebi anipa ne da na ho na ekokko no umma on that side ni biom isan sa oda ho biom efe wu ahwe ni a ebebie nti no wodi transparent foam dressing no ana foam dressing wodi to ho a ubon se ebe 3-5 days no na ubon se kokko no ekọ isan sa we relieve pressure no and we protect the area ho so ube make sure say nsuo so enko sa area ho inti say eye ne to echi ene ba ya ube won say ube hwe say ho no ebe ye dry na wodi foam dressing na ebe to ho na eye na ye silicone ube won say nsuo enko around sa area no na e protect sa area no na uba stage 2 na stage 2 no ube won say ho no ebi ho na abo impumpunja ana say impumpunja na pai inti ube won say ayekru ana say fiase say ayekru dada ana yes stage 1 na ye kokko no wan hwe ne yie na efe de ekuru no ebie so obinya stage 1 no na se wan dane no na woma ne da bebi ho na ekuru no ebebie ebie a na efe adane stage 2 na stage 2 no ekwan a yebefa so a yehwe stage 2 ne se ubeyi pressure na efi ho se ho no nipa no bebi oda no se ne nenti anase ne chi bebi oda bia na onya saa ekuru no me man nda saa side hobium oda kro ni so a ekro no betu akwaechire into be relieve pressure no na efe wo the dress na ye friend hydrocolloid esanse ekro no ebie ni ti no wo pe dress na wo ebetimi ai twinsuo no but emma ekro no enwo stage 2 no ekro no ye mpese ekro nim be wo wese ekro nim ye wese a menche se ekro no ehili ye pese ekro no nsuo kakra wo ani enye nsuo bebre de into be choose dressing a entry nsuo ni bebre na ema nsuo ni dry into no dressing me no ameka ho asem ye freba ko hydrocolloid and ye freba ko so foam dressing ye wo thick foam ne ye wo lighter foam into say nsuo na efikrom no mu ndoso a wo so use lighter foam no na ama ekro no nsuo e wo ekro nani no aye pepepe a ebeboa ama ekro no ehili ekro dry bebre ya new tissues no intumi engrow into no se ekro nanim ye moisture obe se cells need to me moving around that aboa with wound healing no into no se adano me ka ho asem in previous video say ye na se ekro enime wu a ye fi se ewu dabi ekro enimu wu a ye mpensa se ekro kese tu a ye mpese ekro nanim be dry especially pressure injuries no eya na ye mpese ebe dry too much na ebe heali with the moist environment na ubehu se na eno ankasa ehili intino mijiri says adisuin aboye next video we're going to talk about stage 3 and stage 4, how we manage our stage 3 and our stage 4, but we have to ensure that our stage 2s do not progress to the stage 3s and the stage 4. The next video yebeka ekro no se etu ekwechire na ekoye stage 3 and stage 4 na ekwan ben yebefa a yebehwe saa ekro yi na ankwanko ye ekro kese a yeko a enko yakopon enhyan bebre. So you subscribe for more videos and stay tuned for our next video on our management of stage 3 and stage 4 pressure injuries. You stay blessed. Bye for now.